I'm Dr. Herbert Neuman, Vice President of Medical Affairs and the Chief Medical Officer for Covidien Pharmaceuticals. At the American Pain Society, we've presented data regarding the physical and pharmacokinetic properties of our product Exalgo, which is a once-daily form of hydromorphone. The data reflects the physical properties that may help inform clinicians as they choose products for their patients who do require continuous chronic opioid therapy. Specifically, our data reports that Exalgo requires a greater bite force to actually chew the product when compared to a comparator long-acting opioid. As reflected in other research, more than 75% of abusers actually use the product orally. So the impact of a formulation that requires greater bite force may help clinicians choose products in patients where they have some concerns around abuse or misuse. Similarly, that data also shows that when the product is milled or ground in some way, it is thicker in consistency than a comparator product. Specifically, we compared it to olive oil and the ability to draw up the product in a syringe. It was much more difficult to draw up our milled product versus olive oil. And the consistency of olive oil alone is difficult. And so making it more difficult or less likely for someone seeking to abuse the product to actually try to inject Exalgo versus the comparator. Also in this data set was a review of a model of an intranasal delivery system. So it was an in vitro model, and when exposed to this delivery system, Exalgo had a lower amount of available product than a comparator molecule, all of which points to the direction that people who would choose to abuse products are typically looking for material that would give them an immediate impact of the drug, as well as a higher concentration of the drug. As a companion abstract presented today, looking at the pharmacokinetics of Exalgo, the demonstration was that compared to immediate release hydromorphone, extended release hydromorphone once daily gave a lower Cmax, or a lower maximum concentration, and that maximum concentration was achieved several hours after ingestion, compared to immediate release hydromorphone, which has an immediate spike on the order of 45 minutes or so after ingestion, and the spike is actually a higher concentration on a milligram per milligram basis when compared to the extended release OROS hydromorphone. We're very pleased to present this information at a scientific assembly like this, hoping that this information will help clinicians as they choose products that would be most appropriate for their patients.
Now, let me ask a question. When you talk about crushing it, aside from the bite force needed, it's harder to chew this, but in crushing it, is there still a way for someone to crush it and then ingest it, not inhale it or not use it as an injectable? Is that still a possibility, and was there any looking at that?
Yes, there is data showing that if this product is chewed or crushed and ingested, the pharmacokinetics is greater than when it was taken as prescribed, yet still less than the dose available in a comparator long-acting opioid that was subsequently chewed and crushed. Similarly, if the product is soaked for 24 hours in water, it still maintains a higher bite required to crush it than the comparator molecule.
Okay, all right, thank you.